Hello, my name is Michelle Quesada, and today I am presenting my career portfolio, the digital storytelling portion, and I have decided to present on the career of physician assistants. Physician assistants examine, diagnose, and treat patients under the supervision of a physician. For most, this is typically a full-time job in physicians' offices, hospitals, outpatient clinics, and other healthcare settings. A master's degree from an accredited program and a state license is typically required to enter the occupation. The growth percentage for this job is 28% from 2021 to 2031, which is much faster than the average for all occupations. With this, 12,700 openings for the job are projected each year as a result of the need to replace workers who transfer to different occupations or retire. As of May 2021, the median annual wage was $121,530 for physician assistants. Ever since looking into becoming a STEM major, I knew patient care and interacting with those patients is what I wanted out of my job. While becoming a surgeon was also a great route, I knew that the lifestyle held by many surgeons was not the ideal way of life I would like to take on. When in high school, I received my CNA certification, and by all means loved it, but knew that becoming a nurse wasn't exactly what I wanted to do. When I found out PAs existed, it fell right in the middle of the two extremes which didn't seem to fit my personality. Another aspect that was very intimidating, yet admirable about surgeons is the great responsibility they hold. As a PA, I would still be on the team with physicians or surgeons and other healthcare workers, yet under their supervision. Having the ability to examine, order and interpret diagnose, provide treatment, educate, prescribe, and ensure quality patient care is all I could ever ask for. I interviewed a physical therapist due to the fact that I work in an orthopedic rehabilitative clinic immersed in the environment. I was always set on pursuing obstetrics or endocrinology, but have grown fond of the physical therapy area. This is also attributed to my major being kinesiology, which definitely opened my eyes to the amazing things that can be done within the field. If you are passionate about helping people overcome health challenges, a career in the medical field may be a great choice for you. Physician assistants and physical therapists both provide care to their patients and support them in achieving their health and wellness goals. Some similarities and differences are that PTs cannot prescribe and PAs can, and some pros and cons I will list now. So, PAs typically have a broader scope of practice, and they may specialize in areas like family medicine, primary care, pediatrics, or emergency medicine. PAs practice medicine under the supervision, either directly or indirectly, of a physician, as previously mentioned. PTs practice movement science or kinesiology and use that to help people with disease or dysfunction return to or maintain a functional lifestyle. Some examples are walking to the bathroom, putting on a jacket, lifting a suitcase, returning to work or sports, and many others. These therapies usually involve working on joints and muscles, and physical therapists, as I mentioned, aren't certified to prescribe medications. PT is super important in the field of healthcare and absolutely necessary. It's important for people to maintain and build motor function in order to prevent deterioration, proper coordination of movements, and safety. For example, a good PT program can help prevent falls in the elderly and neuro patients. Some cons about both fields would be that PT has an awful debt to income ratio, and PAs have a higher income than PTs. A con to being a PA, some say, is the lack of autonomy. If that is a must for you, maybe PA isn't the only route you would like to look into. You are in close contact with the doctor at all times, most of the time. PT also has many pros aside from the income and debt, which include having more time throughout the day, even if it involves working with 10 to 15 patients per day. Being a PT is very fun, and you may see a patient 2 times a week for a couple of weeks and really get to know them, which is an aspect I really like about the career and a reason as to why I would also consider physical therapy because the patient interactions is something I would love to still encounter. Every single position will basically have its pros and cons. It is all about the factors which are most important to you and what you can live with yourself doing for the long term. Thank you.